Okay, so today we are going to talk about Indigenous people and our current healthcare system. But first, we are going to look back at some of the core topics that were discussed in class. So the first one is about the social determinants of health, which are non-medical factors that influence our health outcomes. They are usually determined by where we are born, grow, and live. And they include things like your living conditions, income, education, access to housing, and environment. They are shaped by broader systems like economic, social, and political one, and they can lead to health inequities, meaning unfair differences in health between groups. Across all countries, we can kind of see a social gradient where people with fewer resources generally have worse health. Healthcare is one of the social determinants of health, but it's not the main one. Access to medical services, affordability, and quality of care, they all do affect health, but most of what determines our health comes from the conditions we live in. It's also important to know that socioeconomic and political context, as well as social position and material circumstances, they all play a role in health outcomes. By that, we mean the rate of mortality, morbidity, and hospitalization. And they create inequities which can then be addressed by the policy cycle. This starts when an issue gains attention, then possible solutions are developed. The government then decide which approach they should take to address these issues. They implement it and finally evaluate how well it worked. The policy cycle can help us see how government can hack on these broader factors. This become especially important when look at the second course topic related to our reflective assignment, which is about healthcare policies for Indigenous people. In class, we talked about healthcare policies are affecting Indigenous people, but also look at some of the structural determinants of health that are specific to Indigenous people's health. They exist at three levels. So there is the proximal one, which includes daily living condition. This means like housing and access to care. There is also the intermediate determinants, more of community systems such as education, infrastructures, and healthcare. And finally, there is the distal determinant, which include the broader historical, political, and social context. And when looking specifically at Indigenous people, we can maybe think of colonization and systemic racism that still continue to influence health inequities today. We also took the time in class to look at policies that were implemented by the government to help address some of these inequities, such as the Joyce Principle, the Vienn's Commission, and the Truth and Reconciliation Calls to Action that were created to promote equity and cultural safety in healthcare. However, in class, we also saw that their actual impact can be limited. They've helped raise awareness and accountability, but many barriers and mistrust in the healthcare system still persist to this day. And while they do help raise awareness and guide change, the inequities in access, trust, and outcome can remain.
So now let's move on to our thoughts and reflections of the course topic. So first, after compiling together our reactions to the lecture content, there were some emotions that stuck out more than others. And first of all, we're mainly pleased and overall happy to see that we're just discussing Indigenous people in class and that we're given the opportunity through our studies to learn about their experiences and hardships in the healthcare system. However, the majority of the other reactions we were having were more negative. There was a combination of sadness and frustration in hearing about tragedies that could have been easily avoided, and by the overall amount of progress and understanding that we find our system is lacking in. There's also some shock and just feeling overwhelmed by the impact and the effect that this has on the Indigenous community and really how complex this issue is, how it's so deeply intertwined with the social determinants of health. And I found that our reflections fell into mainly two categories. So we're either reflecting on our healthcare system or reflecting more on Indigenous people, mainly seeing in the system the mistrust that's been built, the lack of access to healthcare, and then the presence of historical trauma in Indigenous people and that's effect. And as we previously mentioned, these psychosocial factors that are playing a bigger role in healthcare. And so this gets us to start thinking, how do we address this? Where do we go next? And so our future in rehabilitation, we hope to make an effort to be educated, to learn more, being open-minded to different practices and cultures. We also want to be more aware of our own biases, these internal factors as well as external factors that play a role, and the things that we just cannot control in the system. And we hope that with an emphasis on community, we can find balance, connection, a return to identity for Indigenous people. And last thing is we also want to just be empathetic and allowing space for mistrust and discomfort that's been built in the system, while also encouraging growth and understanding to come through. And lastly, we also want to think of, what could be a good next step for Indigenous people in healthcare. Could that involve finding a way to combine, modern biomedicine and traditional medicinal practices? Perhaps we can educate ourselves and other healthcare professionals about these practices, but also Indigenous communities as well about what we're trying to achieve. And an overarching question we ask ourselves is, are we able to fix the system to give us these things and allow for change with the way things currently are? Which brings us to our focus question topic, which is how are we currently trying to incorporate Indigenous healing practices into the healthcare system?
Now, to answer this research question, we conducted a targeted literary search using academic databases and official public health sources. We mainly use PubMed and Ovid to locate peer-reviewed health science research. And for more targeted Indigenous research, we used the Native Health Database, the National Collaborating Center for Indigenous Health, and the Truth and Reconciliation Report. We may also have used Google Scholar and Scopius to capture their disciplinary and policy-related publications. We then search with keywords like indigenous health practices, traditional healing, cultural safety, twice seeing, because the method that they are traditionally used to heal. Uh, Integrated collaborative care, rehabilitation, healthcare reform, and Canada are some of the other words. For our criteria, um, our publication focus on the post Truth and Reconciliation Report period from 2015 to now to ensure policy relevance. They also prioritize the Canadian context with comparative examples from other regions with research on their Indigenous healthcare policies impact. The articles also discuss integration of Indigenous and Western healthcare approaches with policy documents, qualitative studies, and RCTs relevant to rehab, community health, or primary care. So initially, we searched broadly to include the Indigenous health and integration. We then narrowed to programs relevant to rehab and healthcare system integration models and expanded for more comparative purposes to other countries when the relevant Canadian literature was limited. So in conclusion, for our research methods, we mainly use PubMed and Indigenous specific databases with keywords like Indigenous health practice, integration, and rehab. We focus on the publication of the past 10 years to identify policy, programs, and collaborative care models in Canada and in comparable Indigenous contexts.
So in this next part of our presentation, I'm going to summarize some of the key information that we discovered in our research. So first, I'm going to speak about some of the challenges. So for one, the founding philosophies of Western and traditional healing systems are quite different. In Western medicine, there is a focus on individualism, biological causation, and empirical evidence. In traditional systems, it's more holistic and spiritual and focuses more on community-based approaches. Only 10 to 30% of healthcare in the world is delivered in the Western way. Yet traditional healthcare practices are looked down upon for not being scientific enough. Some of the terms used in the research to describe the traditional systems were exotic, primitive, demonic, and magical, and we're criticizing them for not being based off of evidence. But the Western system is not free of criticism either. There are hospital-acquired infections, and there are errors with medication that were highlighted. So both systems have strengths and weaknesses, but the traditional practices are often viewed more harshly. Another challenge that came up was the mutual distrust and lack of communication between Western trained and traditional practitioners. Efforts for integration were also often met with suspicion. There was also a challenge in studying the oral traditions and performed knowledge, which was often resisted by the traditional practitioners. So we also discovered in our research what some of the critical factors were for success in integrating Indigenous traditional practices in the Western healthcare system. So the key overall was collaboration and Indigenous leadership. So for instance, it was important to have consultation with elders, knowledge keepers, and Indigenous researchers. It's also important to include culturally appropriate components. This helps address barriers to care, for instance, by creating community-based clinics and providing access to elder or Indigenous healing practices. There was something brought up called the two-eyed seeing framework, which was proposed as an effective approach to help blend traditional and Western therapeutic practices by drawing strength on both the Indigenous knowledge and the Western knowledge. In this next section, I'm going to highlight some of the programs in Canada that are already incorporating Indigenous healing practices. So I will speak about a few different categories in healthcare. So first, I will speak about midwifery and birthing. So as you can see, there are some Indigenous doulas programs happening in British Columbia and Saskatchewan, as well as some Indigenous birthing centers, such as ones in Quebec, Nunavut, and Ontario. So doulas provide emotional, physical, and spiritual support, and the birthing centers complement modern midwifery with Indigenous traditional healing practices, including traditional herbal medicine and ceremonies. So diabetes is very prevalent in some Indigenous communities. In Alberta, we have the Aboriginal Diabetes Wellness Program, which incorporates traditional healing models, which leads to improved patient self-care and community satisfaction. Under the same program, there are tele-ophthalmology services. These adopt additional Indigenous traditional knowledge and healing practices, such as healing circles, smudging, TP, and traditional healers, which helps to overcome cultural barriers and increase patient attendance and adherence. In terms of mental health, there is the Youth Solvent Abuse Treatment Center and the Healing Lodges Counseling Program. Some of the features of these programs are that elders assess patients. The treatments used are spiritual interventions, traditional healing songs, and traditional medicines. And they incorporate cultural practices like prayers, talking circles, and smudging pipe ceremonies. In terms of palliative care, they are using traditional teachings and support to help staff, patients, and family deal with death and the grief process. And this helps provide culturally appropriate care for end of life. So I'm just going to summarize some of the overall benefits from these programs. One is that they help to overcome geographical and financial barriers to patients by bringing the services to the community instead of having to have the individuals travel to urban areas, which could often be quite far and quite tiring. They help to overcome cultural and social barriers, and they create a more traditional hospital-based setting. They also have been shown to increase patient satisfaction. They have shown improved maternal health outcomes. They have shown to have a high participation with youth in the mental health programs, where the youth found the process more supportive of their self-identity and self-determination. And they also helped overall supporting Indigenous autonomy. For instance, by returning birthing to homes of families, and also increasing access for palliative care in the homes, which allowed for more home deaths, which provided dignity of the dying and allowed them to be with their loved ones. So now I'm going to explore a program that was incorporating First Nations, Inuit, and Métis traditional healing spaces within a hospital setting. So in this program, they created traditional healing spaces at the Center for Addiction and Mental Health in Toronto. The study examined how Indigenous healing practices rooted in land-based knowledge are being incorporated into a colonial hospital setting to support Indigenous patients' mental health and well-being. So the spaces included the ceremony room. Ceremony room is an indoor space that could be used for smudging, talking circles, and other ceremonies. The second space, the ceremony grounds, is an outside area where they had sacred fires, medicine gardens, and sweat lodges, The third space is the Echo Room. This is a virtual care space used for connecting Indigenous communities with the hospital services. It's also used as an educational space in which the elders can share their knowledge. This initiative was well received. One of the study's participants said, having ceremonial spaces within the hospital really affirms our connection to the land base and therefore who we are as Indigenous peoples.
So in conclusion, we wanted to look back at what we can do as rehabilitation professionals in the healthcare system. So of course, providing quality and culturally safe healthcare for Indigenous people means, of course, adapting our practices to truly meet their needs. This can include supporting care within their communities, even at the end of life, by creating home environments that allow for dignity and comfort. It also means collaborating with community leaders and approaching each situation with openness, respect, recognizing trust, and understanding that it can take time to build. Finally, it is important to remember that there are many different Indigenous nations and communities, each with their own values and tradition, and we should not assume that one approach works for all. Instead, we must keep asking, listening, and learning from the people themselves.